I've been involved in HIV-related work and advocacy, which included key populations, since 2009, and I've been teaching and training on gender-affirming healthcare since about 2022. But my involvement in this clinic started this year, 2025, after the devastating impact of the withdrawal of PEPFAR funding. So in Buffalo City Metro, care for transgender and gender diverse people has always been provided by WITS RHI here at Duncan Village Day Hospital for the past 5 years. But in February, they were forced to suspend services, and at the end of March 2025, the clinic was actually closed. Services to key populations fall under the Department of Health HUS Directorate, and as Department of Health, we had to find a way to continue this particularly important work. So in April of 2025, through the CMH Family Medicine Department, we decided to establish this outreach clinic and to be able to continue care for all the existing patients as well as initiate treatment for new ones. I'm Dr. Madeleine Muller. I'm a family physician at Cecilia Makiwane Hospital, and I also work as a senior lecturer for Walter Sisulu University. So I've got medical students, interns and registrars that I teach. But today I'm here doing outreach at the Buffalo City Metro Gender Affirming Healthcare Clinic, which is based next to Duncan Village Day Hospital. I believe that the measure of the quality of a society is how we look after our most vulnerable people. And with vulnerable, I mean those that do not have a voice, that do not have the same level of power or influence over what happens in their lives as compared to those that are more privileged or powerful. So one can be more vulnerable due to socioeconomic factors, race, education, or in this case, falling within the LGBTQIA+ identities. All the transgender and gender diverse people in our communities need to be seen and to be affirmed that we see them. And it's been utterly devastating and dehumanizing for services to the TGD population to just be abruptly cancelled like that. So as the DOH, and now for myself as a family physician, it has been absolutely essential to pick up the slack and to ensure that no one is left behind. No one should feel that they do not matter.
My name is Professor Alma de Vries from Nelson Mandela University Medical School. I met Dr. Muller years ago through the Rural Doctors Association, where she's been an activist for rural health. I nominated her because she has worked tirelessly to find solutions for access to gender-affirming healthcare in the Eastern Cape. She has been advocating for access to gender-affirming care by Department of Health, and when the dedicated WITS RHI trans clinic was closed because of the funding cuts, she stepped in to facilitate the trans clinic in East London.
I was completely bowled over. Apparently there were hundreds of nominations received, and I'm deeply honoured that my little story has been selected for this award. I do hope that it may highlight what is possible for other clinicians in the Department of Health that are wanting to help our key populations.